Cystic fibrosis, commonly called CF, is an inherited disorder that affects predominantly the lungs and digestive system. Treatment in the past has been aimed primarily at treating these symptoms. With this therapy in my career, I have seen an improvement in life expectancy from 18 years to late 30s and even beyond. Recently, a novel therapy has been developed that completely reverses the defect in a small number of patients. There are ongoing studies that will hopefully extend this therapy to all patients.
In order to break up the thick, sticky mucus caused by cystic fibrosis, King receives chest percussion as part of his daily respiratory therapy. He began these treatments at 3 months of age.
It was very hard to wait on the diagnosis, but once we were actually diagnosed, we knew what we had in front of us.
King's pancreas is affected to the degree that it does not provide sufficient enzymes to digest fats, proteins, and starches. In addition to taking enzymes by mouth before each meal, he requires nutritional supplementation via a feeding tube.
I think the hardest part was making the decision to get the feeding tube. We saw that as something that was so unnatural and scary, when in reality, from a daily regimen standpoint, it turned out to be one of the easiest things that we do. But it's really hard to admit to yourselves, to doctors, to your community that your child's body is literally failing him at such a young age. That's a scary thing. And even though it's turned out to be simple, it's hard at night to want to lay down with him and cuddle him to sleep. And I literally cannot do that because he's hooked up to a feeding tube for 10 hours overnight. So I can't take him out of that very important routine and put him in bed with me at night. I would give anything to do that.
King does between 2 and 5 hours of respiratory therapy daily with 4 inhaled medications. We also do a 10-hour nighttime feeding with King every night. King has had several hospitalizations for respiratory infections. We've had to run IV antibiotics for him at home, and we've also had to have several sinus surgeries to take care of some nasal polyps.
I think that sometimes families don't want to share the daily battle of cystic fibrosis because they don't want to look like they're complaining. And we don't want to look like that either, but we also know how important it is to share his story so that people know how much help we do need. And when it really boils down to it, King's life and the lives of others living with cystic fibrosis depend on it. They depend on that support.
CF affects each person differently. There are over 1,800 confirmed mutations of the disease, and each person can have different combinations. Some people do not develop symptoms until later in life, while others battle from their first breath. Mary Alice is an energetic little girl. She plays soccer and basketball, among other things. She uses her trampoline to help her with the respiratory therapy. Jumping helps to loosen the mucus in her lungs.
She's 9 years old and a very willful and stubborn 9-year-old like I was when I was little, but we're persistent and we make sure that she does her routine every day, and that's something we try not to wave on. She does her breathing treatment and her vest every day, and that's something that she understands that is very important for her well-being.
Cystic fibrosis is characterized by abnormal transport of sodium and chloride along the epithelial cells that line the respiratory, digestive, and reproductive systems. This leads to the production of unusually thick, sticky mucus, which can cause life-threatening lung infections, obstructions in the pancreas, and infertility.
Mommies have this laser focus that, I've got to take care, I have to take care of this child. Fathers want to fix it. And I kind of went through that. I couldn't fix it, and I kind of went through this. And I remember Bridget telling me, we have 2 choices about this. We can wallow in this and feel sorry for ourselves, or do something about it. And I think that's where, we came to this, we don't have a choice.
Brandon has lived a very active life. He plays the saxophone and tennis to help him stay fit and keep his lungs healthy. He recently transitioned from living with his parents to life in a dormitory as a college freshman.
I requested a single with a bathroom so I could clean my medical equipment and so I could have some privacy doing my treatment, because I think it would be a little bit awkward doing treatment like that with somebody you don't really know. And obviously the people on my floor know I have cystic fibrosis, because everyone asks why I have a single room. And I always tell them it's because I have cystic fibrosis, and it's gone smoothly, I guess.
In the 1950s, few children with cystic fibrosis lived to attend elementary school. Advances in research and medical treatments have enhanced and extended the lives of those living with CF. Many patients now live into their 30s, 40s, and beyond.
I hope we don't have to deal with this anymore. I hope that there's a little pill that people can take, that they just don't have to, get sick and go into the hospital and be sad to be away from their family and their friends and their dog. That they can grow to be, go to college and finish college, and they can fall in love and get married and have children and even be grandparents someday. Those are all the joys of life that I hope for him and everyone like him. Yeah.
As a young married man, Andy must consider the future and the family he wants to have.
Well, for myself and my family, it's just, I can grow old and stay healthy and watch our kids grow up, and they not have to worry about their dad getting too sick and something bad happening earlier on in their lives.
Beyond family, Andy focuses much of his effort on educating others with cystic fibrosis.
Don't be distracted by other things in life. Make sure your medication and staying healthy and getting exercise is a priority, because again, if you stray away from those, from your daily habits and daily rituals of taking your medicine, then that's when the serious health issues arise.
My hopes are that Andy can continue to stay as healthy as possible for as long as possible, and that the CF Foundation will continue to develop medications that will help Andy and others living with CF to do that as well.
Virtually all of the medications and treatments for CF have been developed through collaboration with the Cystic Fibrosis Foundation. Kalydeco is a drug that was approved in 2012. It addresses and corrects the root cause of CF in 4% of patients. Research is aggressively ongoing to model other drugs after Kalydeco for the other 96% of patients living with CF.
The root cause of cystic fibrosis is being addressed and corrected in a small percentage of patients due to landmark research partially funded by the Cystic Fibrosis Foundation. Now is the time to help bridge the gap for 100% of patients. On average, 90 cents of every donated dollar to the Cystic Fibrosis Foundation is allocated to life-saving research, patient assistance, and patient care programs. You have the opportunity to fund research that will make the dreams of those living with CF come true. The CF community thanks you for your generosity, and we look forward to celebrating with you as research gets closer to changing the lives of those living with CF. We may not have a cure, but we do have hope.